Good day and welcome to another edition of One-on-One with Swope Health. I am your host, Eric Wesson. Thanks so much for joining us today. We've got a great show planned for you. Our guest today is Mr. Dan Cranshaw, and he is the president and CEO of Kansas Health Collaborative. Thanks so much for joining us today.
I'm grateful to be here. Hanging out with someone, a superstar like yourself. I'm
Where?
The same rarefied air.
So, tell us about Dan. Are you from Kansas City?
I'm not. I'm originally from Springfield, Massachusetts, a little small town. My story I tell is it's where basketball was invented and where KU's only losing coach came from, Mr. Naismith. So I moved here in 2020. I had a brand new baby at that point, one child, and I was married at the time. Came out here to work at Sprint. My wife came out here to work at Sprint. I came out, went to KU Law for a little while. Actually, my boy was probably 3 months old at the time when we moved out, and I thought I was going to be a stay-at-home dad while my then wife was going through the executive training program at Sprint. And she looked at me and she says, "Well, I'll be damned if I'm going to work 12 hours a day so you watch Barney all day long." So we found very good daycare for Graham, and I went to law school.
Okay. And so
after law school, I was fortunate enough to get a job at Lathrop Gage, now Lathrop GPM, and I stayed there for 10 years, practiced law, and then after that went to Polson and practiced for another 10 years there. So 20 years total. During that time, I was working on commercial litigation, products liability, civil defense, B2B disputes, but then also spent a lot of time, which is probably what brought me here, sitting on a lot of boards, focused on urban core issues. I am reminded that I've been enormously fortunate in my life, and I've been trying to find ways to pay it forward and pay it back as often as I can. So throughout my legal career, I sat on a lot of different boards, focused on urban core issues, economic development, affordable housing, and healthcare. So happy to be here.
And one of the things I saw was DEI. You were a specialist. Now that's a bad word.
That's right.
But right. At one time you did focus on diversity, inclusion, and equity and inclusion.
I did. So at both law firms, what I learned early on is there is a benefit to ensuring that everyone feels connected to the organization. It's just part of the cultural aspect of it. And I worked under really great leadership that was part of that. So I did my part to make sure that the few black and brown attorneys who ended up at these big law firms felt like they belonged, and conversely made sure that folks white folks, basically white attorneys who were looking to make sure that they were building a culture of inclusion, had the tools to be able to do that. So I looked at that as, and you're exactly right that it's been butchered a little bit.
Yeah, it has been.
DEI really is about making sure that everybody feels connected to an institution. And I think we did a very good job of that in both of those spaces. Okay.
So now, fast forward almost 2 years ago to the day almost.
That's right.
You came in at the Health Collaborative.
Yeah.
So what exactly do you all do?
It's a good question. So I'll back up a little bit. So at my 20-year mark, I had thought about what I wanted to do sort of with the rest of my life. I've got an 18-year-old daughter who's about to graduate, so we're sort of at that empty nest stage. I practiced for 20 years, and I wanted to do more mission-focused work. And so there are a couple of instances that popped up in my life that created that opportunity. COVID happened, which made all of us kind of wonder what we were doing. I was diagnosed the second year of COVID with cancer, and that was sort of a wake-up call as well. And I felt like the universe was saying, you need to, if you're going to do this mission-focused work, you better get to work. Mm-hmm. So I started looking around for organizations that aligned with my missions of advancing equity, creating opportunity, and providing resources to under-resourced communities. So this popped up on my radar from a really great headhunter, Michelle Anderson over at Omni Resources. And what I loved about, and then the Kansas Health Collaborative. 10 years, we're celebrating this year. We were incubated by Blue KC back in 2015 with the idea that they wanted to do a better job of providing health care for folks who weren't getting health care in between emergency room visits. How do we get them better health care? How do we lower costs? How do we provide better health care for the entire community? So through that discussion, they brought folks to the table from other insurance companies, they brought employers, they brought union members, and the idea being, let's talk about what can we do to make healthcare better for everybody. And so from that, there's a recognition that this is a resource, this is a convening table, this is a gathering space, a community table where people can get together and think about, and this was before SDOH became kind of a big topic for conversation, but social drivers of health. This is a table where we can talk about addressing how do we resolve social drivers of health, those factors outside the clinical space that impact all of our health. 80% of our health is impacted by where we live, our economic situation, as you know, our ability to get places, transportation. And so we are now working together with a whole bunch of community members from those sectors trying to advance health equity. How do we make it better for everyone? How do we ensure that everyone has an opportunity to live their happiest, healthiest lives?
So when you give us a scale of 1 to 10, how healthy is Kansas City?
Oh, that is a great question. You didn't give me a question today. That's pretty good. That's pretty good. You know, I think we're getting better. I think the challenge is, and one of the needs that we are addressing is it depends. Lawyers always say that, and people hate that, but it does. It depends on where you live. And that, to me, is one of the biggest frustrations of the work, but it also presents the greatest opportunity. So, for instance, in Brookside, where I used to live, 64113 has the highest life expectancy in Kansas City, Missouri.
Right.
If you go just a little while east, 64128, it is the lowest.
Right.
14 years life expectancy drops just because of the zip code that you live in. And so we've got to do better, it seems to me. And I think part of what we do at the Collaborative is to elevate awareness of that. So I invite everyone listening to, we're on social media where we talk about health equity. We've written op-eds talking about health equity. We want everyone to know that this is not just a black and brown issue or an east of Troost issue, that if the folks on the east side of Kansas City, Missouri have these lower life expectancies, if they're not treated well in the healthcare spaces, if their opportunity for economic advancement because of their bad health is being impacted, it impacts the entire region. And so you can't, and COVID taught us that, this idea that, well, we're going to think about those folks who went off to their summer houses or their second houses thinking they could get away from COVID, when in fact it was a pandemic. And it seems to me that health inequity is also a pandemic. Man-made, constructed, which means that it can be fixed by folks as well. And so that's what we're trying to get done.
So you bring up a great point that people kind of speak of in passing, and then it kind of gets swept under the rug. The differences in zip codes in Kansas City and life expectancy. So do you think any of it goes along with economics? Example, you mentioned Brookside. So you go to Price Chopper, they got fresh fruits and vegetables and meats and dairy products, and it's a conducive environment in that grocery store for people to be healthy. But if you come on the other side of Troost, we have young people that say, and I used to like grit my teeth when I hear it, young people say, I'm going to the grocery store, and they go to a gas station.
That's right.
Because they're selling meat, bologna, bread, and milk there, but there's no fruits and vegetables. So do you think the economic trends are going to eventually come over to where people realize you have to have those same things east of Troost?
I hope so. I mean, I'm going to do my part to make that happen. And one of the goals that we've got is to identify relevant health data for the city to help policymakers appreciate how important that is. Because right now, you and I understand that, and there are some other folks who will understand the differences between living in Brookside in living in Wendell Phillips from a health equity standpoint. We've got to help more people appreciate that. I think if more people understood the difference of life expectancy in our own city, in our own region, if they understood, for instance, black maternal health has become a hot topic as well, that black women, irrespective of how much money you make, are 3 times more likely to die of preventable medical issues during pregnancy just because they're black or brown. And so we've got to be thinking about why does that take place? And let's show what that data is revealing to us, that difference. And I think that's going to animate people to do more. So I think, and I know the chamber talks about this, our elected officials talk about this as well, is how do we get to inclusive prosperity? And this is what, ironically, and I want to go old school, but Mayor Funkhauser started talking about this. He was not the best messenger, possibly, but he talked about the fact that we are throwing in a ton of resources in downtown Kansas City, Missouri, ignoring the east side. And what's the connection there? And so we need to do a better job of talking about that. So what I want to do, and we're working on this at the collaborative, is to be an aggregator, a collector of relevant data that drives sound health policy, so people can make better decisions about where they're constructing, where they're putting their grocery stores. So our politicians, when you think about what we're talking about now, think about, we used to talk about the three-peat Super Bowl. We're talking about a downtown baseball stadium. We're talking about what it's going to take to keep the Chiefs in Kansas City, Missouri. We're talking nonstop about FIFA, but we're not talking about affordable housing.
Right.
We're not talking about economic development on the east side. And I think about transportation as a prime example, another social driver of health that impacts people's ability to get to work, to get to school, to get to their doctor's appointments. We are leasing 200 buses for FIFA for next summer, for 6 weeks, to move everyone around the region. Because under the contract with FIFA, you have to provide free transportation to everyone, not only to Arrowhead, but all the viewing stations around town. But there's no talk of how we move people who live here, move around town. So we're okay moving people to Power and Light, to Casey Current. We're probably going to have something down in Johnson County as well. But we're not making sure that Dan, who lives on the east side, can get to work to clean those buildings after these events, or to move east and west. I call it Mayor Cleaver. The Reverend Mayor Congressman Cleaver is working on getting those transportation bills. But this seems to be a prime opportunity for us to be talking, in addition to taking advantage of the international exposure we're going to get from FIFA. Why wouldn't we also be talking to all of those county officials, those transportation folks, and say, why can't this be the backbone of a regional transportation hub where we can figure out ways to provide free transportation for the folks who need it? Because you and I drove here today. Not everybody has a car. Not everybody can afford a car. I don't want to afford a car. And so I'd love to be able to get on a bus or a train. We've got light rail that's able to move tourists from River Market, and we're so excited to get them down to the plaza. But that's not where people who need to work are coming east and west.
Right.
So right now, if you lived on the east side and you had a job over at the Legends, or you had a job over in Wyandotte County, you're looking at at least an hour or an hour and 15-minute commute. And that's just unacceptable to me. So it seems to me that there are players, and we hope to be one of those, who can help drive a better understanding about why that's important.
So, but you brought up something really super interesting. You said there's a lot of talk about it, but are there actions toward making it happen? Because we got the lip service down.
Yes, that's right.
But what about when the rubber meets the road? Are we doing anything that moves the needle?
Well, it's a great question. So I'll tell you what we're doing at the collaborative. It's not advertising, but I think what we're trying to do is to animate the work. So one of the projects we're working on, in addition to the data piece, is we are developing, in coordination with the Urban Neighborhood Initiative, Dr. Jamie Rogers, their executive director over there, we are trying to create a network that's going to connect clinical providers with community-based organizations, a community care hub that begins addressing the social drivers of health within the 10 neighborhoods that Urban Neighborhood Initiatives worked with. Our goal is to show by example and to lead that if you are willing to make an investment in addressing those social drivers of health, you can change the trajectory of people's lives significantly. And so not only their health, but also their economic fortunes. Because one of the other aspects of healthcare that we can't ignore is that it is a huge part of our economy. And so we've got to find a way to address people's needs, to ensure that folks have access to high quality health care, and make it more affordable, make it more accessible. So that's the part that we're doing. So we want to lead by example. But the other, in my mind, aspect of the work we're doing is that data will drive better decisions. And so if we can highlight, so there is a lot of lip service, but they use what one of my friends calls anecdata. They're not looking at kind of real numbers. So we can talk about the absence of fresh fruit over there, but there's enough data that we can show. Let's talk about how much fresh food is available for a Brookside resident or Johnson County resident, and see what's available on the east side. And then I think that drives action, because then someone is going to better appreciate the fact that this is just unacceptable. And it's my whole, and it's unacceptable on a number of different levels, where it's unacceptable if you're pro-life, it's unacceptable if you're progressive, it's unacceptable if you believe in sound business development and economic advancement. You can't ask major corporations, major teams, companies to make investments in a community if you're not taking care of everybody.
What about housing? Because you mentioned housing as well as one of the indicators of life expectancy. So what are we doing about, I hate to use the term affordable housing because I have yet to define what is affordable housing. What's affordable for you might not be affordable for me. But what are we doing to move the needle when it comes to affordable housing? Realistically, what are we doing?
Well, I think the ordinance that was put in a couple of years ago is a start, because it does bring more awareness to the need to have more affordable housing, and for some of our tax dollars to support that. I think that it is complicated, and this is one of those issues where I don't. It's hard to. You can't sugarcoat it. Is that I think we put a lot of pressure on government to do more to advance affordable housing, but the biggest challenge we've got to recognize is governments don't build houses. Developers build houses. And so the question is, and the opportunity is, how do we incentivize that development? How do we create opportunities for developers who are happy to run downtown? And I can remember years ago when everybody said no one's going to live, when they were developing Power and Light District, no one's going to live downtown. Why would you want to live downtown when you could have 5 acres out in Johnson County? And now we've got 4 light. We got 5 light under consideration.
Right.
And so how do we incentivize that and make sure that folks recognize that this is an important investment in the entire region, in the entire community? And I don't, as we sit here right now, I don't know that I have the answer, but I think we do. This is one of those times when talking is a good thing. Let's keep talking through that to figure out what do we need to do more of. Now, I will say, I sit on the board of Urban Neighborhood Initiative. We have got a great partnership with Van Trust Realty, and they are working on some interesting models where they are accessing properties from the land bank and developing that property and creating a rent-to-own program. Very early days on that. I think that opens up some opportunities. The Reverend Mayor Congressman Cleaver was a part of that effort as well. And so I think we need to be thinking creatively, and I think we need to commit to some trial and error. I think that's really what we've got to be willing to do, is understanding that there's no single shot that's going to solve this problem, but we need to try, assess, update, and try again, and keep going, because failure is just not an option. And as you and I keep saying, the lack of affordable housing is just simply unacceptable. It's just unacceptable for a region, and it should be unacceptable for all of our leaders. And we just have to figure out what that looks like.
And then when they say, because there were one ordinance or one thing that they worked on with giving incentives where they had to have so many affordable units in the development.
Right.
And, you know, I've looked at a couple of them, and you have to go outside to change your mind. They're so small. They're so small.
That's pretty good. I didn't know you were going with that one. I think that's right. It's sort of thinking about putting affordable housing in a power and light building.
Make that make sense. Yeah.
And as someone who came from a family and a background who needed affordable housing, it just doesn't make a lot of sense. And so now the flip side is I'm also old enough to remember where you used to put all of your affordable housing in one spot.
Right.
And
right.
so I think we've also recognized that's also not the best model. And so
Right.
how do we do some of that that mixed-use development? We are also an urban neighborhood initiative working on that, where you've got mixed income levels, because we think that's the best way to move forward. Mm-hmm. The Crescendo project, we're hoping to. I think that's going to be an example of what could work. And so, in lots of ways, we have to work at identifying some pilots, some creative ways to solve the problem, and then identify best practices from all of us, and then weave that together in a way that says this is how you get it done.
And when you do the mixed housing, then you get better grocery stores.
That's right.
You get better transportation. Property value usually increases, but that is something that creates generational wealth, because your kids or grandkids and so forth have something that they can latch onto and take care of.
Well, that's exactly
and pass
right.
down.
Yes,
yeah.
I agree with that. Well, and that also reflects what we want our community to look like. Mm-hmm. We don't want our community to have pockets of wealth and pockets of poverty, pockets of haves and pockets of have-nots. It seems to me that we've got to be thinking broadly about how do we recognize the value in all of our neighbors and all of our communities and figure out how to support them. And so whatever model is working in Brookside, and we keep kind of throwing that up there, but Brookside's a prime example of where early investment by developers has made that a livable space. Then the whole time I've been here, I bought my first house I bought in Brookside. Mm-hmm. Actually, now they say that there's a whole lot of bouginess going on here, but that's a whole other story. But that was planned. That wasn't by accident that took place. Mm-hmm. And so how do we empower, and we've got neighborhood leaders on the east side, and so I want to be sure that we're respecting the leadership that they're bringing to the table, but they can't do that by themselves.
Right.
That master planning came from the developers, it came from government, it came from investment, and so we need to be figuring out ways to do the same on the east side. And so we've got leaders who are ready to drive that effort, and they're doing their part. When I think about one of the best projects I worked on when I was an attorney, one of the last jobs, it was to help clear title over in Wendell Phillips on abandoned houses, working with the ACLU, because one of the challenges, you've got absentee owners, you've got the land bank, which is made, and I don't know enough about it, but there have been enough concerns that those properties aren't being managed as well as they could.
Right.
But you've got leaders that say, I don't want that blight in my neighborhood. How do I attract more investment when people are walking by, driving by, and seeing the house covered in vines, or squatters living inside? And so clearing out that title, getting that cleaned up, and watching that transformation, which can take as little as 18 months, was pretty remarkable. Mm-hmm. And that was on the market, ready to be sold. And so think about if that neighborhood leader had government, more than just the land bank, but a little more investment, some private dollars being moved in there. I think creativity will create opportunity. And I just think we need to keep trying.
Do you think that political will has a lot to do with it as well? I'll give you an example. When I was growing up, Tiffany Springs, you're going up 35 to the airport, 35 north. I remember when tumbleweeds were going across the freeway, and this is in my lifetime. Mm-hmm. My father used to go up there fishing at a friend of his little pond, and I remember tumbleweeds going across the freeway. Now you got Zona Rosa, you got the car dealerships. That whole area is developed, and we still can't get 18th Street, which is only 3 blocks. We still can't get it totally developed.
Yeah, it's interesting you say that. I thought about that when I moved here 25 years ago. I can remember Metcalf and 435 used to be the dividing line between kind of paved road and no road.
Yeah.
And it was just as Johnson County was starting to build out, and you would drive over gravel roads, and but there was a lot of willingness to commit to that. I think there's a lot happening at 18th and Vine. I think there's more development happening. It is, and I know Reverend Mayor Cleaver, Congressman Cleaver has done his part. We've got a lot of private development happening down there. Jason Parson and his crew and Shamari Benton, I know they've done a really nice job of bringing activity down there. I think we're getting there. I'm not sure why it's moving so slowly, but going back to your original question, the Melissas, council persons Melissa Patterson-Hasley and Melissa Robinson, they've done their part. I think we've got to challenge our leaders to pick a spot. Because right now we're sort of all over the place. But I think we need to, I think if we decide that 18th and Vine is our next big focus, and I think we're getting there with the private dollars are driving some investment when you look at what the Negro Leagues Baseball is doing with their construction. I also sit on the board of American Jazz Museum, and Dr. Bennett's doing really remarkable work pulling community together there. I think we can challenge our leaders to do more.
So my always, I want to call it my feather in the hat, is people can come in to the 18th and Vine District. They can have $50 in their pocket, and then when they leave, they got $45 in their pocket because they bought a soda while they were going through the Negro Leagues Baseball Museum. There's nothing there that creates foot traffic. Foot traffic is what drives the economy. You got the Juke House that's getting ready to move out. So basically, on 18th Street, you have the Alvin Ailey, the Blue Room, and the Negro Leagues Baseball Museum and the Jazz Museum.
Yep. There could be more. I think it's my understanding that there's some master planning going on down there.
It's been going on for 25 years.
Yeah, he leans into the microphone. See, what I've learned in my 25 years in Kansas City is I can say, I just got here 25 years ago. Whereas other folks will say, well, you'll get used to it, baby. It's going to be okay. So I think we're getting there. People are thinking about it. I think they're recognizing, they're recognizing that it's an important cultural location.
Exactly.
Cultural spot. And what we're doing at American Jazz Museum is doing our part to demonstrate that we are one of the cultural jewels of the artistic ecosystem in Kansas City, Missouri. And so I think doing a better job thinking about that. And so, and here's the other part I'll throw out as it connects to kind of all the politics that you and I were talking about before we went on the air is if we're feeling that the political will isn't there, then we have to drive it ourselves. And so I would challenge my own board, the Negro Leagues board. I would challenge the developers. Let's convene and talk about what we need, and let's get our own master plan on the board, and then drive our own change. Because the idea that we're waiting for other folks to come save us, anybody in the community, just doesn't make sense. And I think the Fed, what's happening at the Fed level reminds us of that. And so all politics is local. I think we should be looking to local leadership. And it doesn't have to be elected leadership. It could be community leadership as well that says, here's what we want, here's what we need, and here's how we're going to get it.
Okay. So what can we look forward to coming from the collaborative in the next year or the next few months?
It's a we'll be celebrating our 10th anniversary.
Okay.
We'll have some information about that coming online. We're still a small organization, so you're looking at 50% of the staff. So right now, nothing's happening while I'm sitting here. So we are working on that community care hub. We're really excited about that. We're working with Mid-America Regional Council and United Way. We think that is going to be an example of the connection between clinical providers and community-based organization that really makes a difference in people's lives. And we're hoping, and my dream would be in 5 to 10 years, that becomes a regional network that's taking care of everybody in our region, helping them live happier, healthier lives. The other piece is that data piece we talked about. How do we, as opposed to lip service and anecdata, and I don't say that telling those stories about what you've seen and heard don't matter, but I believe that people are going to be moved by numbers, and especially in red states that we live in, people, when they see that the failure to address social drivers of health means that folks can't get back to work, they can't get the best job they can get, means they can't pay the taxes you want them to pay to go into your coffers, that becomes a problem. And so when you look at education, education has been an example of where our red state legislature here in Missouri was willing to move on daycare reform and increase teacher pay when it was demonstrated through data that the failure to ensure that kids were ready to read, that they could graduate with proficient skills, that businesses said, if I can't hire folks and those people aren't ready, I got to go. And so that's when the legislature said, well, that's impacting our business, that's impacting our numbers. We can do something about that. And so I think we've got to make a meaningful and authentic connection between health inequity and health disparities with economic success.
And you got to put a spotlight on the attack or fading away of Head Start, because it definitely starts with Head Start.
I agree. Oh no, I agree. You're talking to a Head Start baby. I totally agree, and I think we we may run out of time, but and I hope you get to talk about the bond that's on the ballot. Is I think education is the key to all of this. In the absence of education, it impacts your finances, it impacts your health, it impacts generational wealth, and so we should all be looking for opportunities to expand education, which is the foundation of everything we're talking about.
Absolutely.
Yep. So,
Rosa James used to tell me, if you can't read, you can't function, because everything you do requires you to be able to read.
That's exactly right.
Thanks so much for joining us. Our guest today was Dan Cranshaw. He is the president and CEO of KC Health Collaborative, and we thank you so much. And we got to bring you back in because we didn't get to talk about crime and how it relates to health and in those various zip codes.
I agree. I'll be around.
Okay, we got part 2 coming up sometime in the very near future. As always, I have the greatest viewing audience in the world. Till next week, remember, tough times don't last, tough people do. Until next time, peace.